Good afternoon and welcome to the webinar series with 𝐭𝐻𝐻𝐿 University presented by the Global Trade Chamber. I'm super happy to see you today. I've been a little bit away of all these activities, but now I'm reactivating all my presentations. So thank you so much. My name is Maria René Dávila. I'm the director for the Global Trade Chamber and also the founder of the Successful Women in Business. Thanks again for being part of this wonderful seminar series. And today we have a special presentation. And for me, it's always a special presentation because there is always something new to learn. This is the guest that we're going to introduce in a few seconds. Is the second time that we're going to have her on our show. And I'm very excited because the first time all the presentation was in Spanish. But not only that, also that we were living a different stage of COVID-19. Now, I believe months passed. We have a different situation. We have a different cases. We have a new era of COVID-19. And I believe that was very important, and it is still important to talk about COVID-19, to talk about all the challenges that we're going through COVID-19, but especially where we are now and what is the new era that we're living with this global virus. So let me introduce and bring to the stage our special guest, Dr. Luz Nieves, infectious disease epidemiologist, and also she is a faculty member of the 𝐭𝐻𝐻𝐿 University. Welcome, doctor.
Thank you so much for the invitation, and I am very glad to be back bringing this information to the community. Thank you so much.
Thank you. I'm very happy. And remember that I remember back that time that I said we're gonna invite you for the second round of COVID-19 webinar because we need to learn more about this. And what I love about the university is that they are bilingual, right? They are bilingual.
Yes.
So the last time we did the presentation in Spanish, today we're gonna do it in English. Next time we're gonna pick another language.
Yes, that's one of the that's one of the beauty of being bilingual and to have an institution, of the caliber of 𝐭𝐻𝐻𝐿, preparing professionals in a bilingual manner in order to meet the needs of, the population. So
Absolutely.
we are very glad for that. Yes.
And Dr. Nieves, I know that today we have a special report of COVID-19, and I love the name that you choose for your presentation, especially now with all the news that new cases of COVID have been reported in the US and also globally in several countries. Again, we're talking about COVID-19. So I believe that the presentation today is going to help us a lot to understand where we are now, but also what we can expect. So the presentation and the stage is all yours.
Thank you so much. Thank you so much to the Office of the 𝐭𝐻𝐻𝐿 President Office, to Cynthia, to Diana, to you for the opportunity to share this vital information with the population, with the community, in order to have a clear perspective of what is happening now and how we are going to move forward. So my next slide is, the title is Myth versus Reality. It's
Can you put it in full screen, Dr. Nieves?
I'm sorry.
There you go. So everybody can see better. Perfect.
Okay, now you can see it better? Okay, perfect. Beautiful. So what is a myth? So I remember when I was very young that we used to play a game, and we have a line of of children, and they gave us a full sentence, and we have to whisper on each person's ear that sentence, and it can say Maria has a red dress and she has black shoes. And then you have to pass that information from another person to the other person to the person on your left until you reach the last person on the line. And then we asked, okay, what was the sentence? And I said, well, Maria has a black dress and then she has red shoes. So the information was completely different than the information at the beginning. So that alteration of the information is very harmful when we are talking about COVID-19. So it's an example, but let's see what is a myth. A myth is an imaginary story that alters the true qualities of a person or a thing and gives them more value that they really have. And then the other, definition of a myth is a fabulous narration that tries to give a non-rational explanation to reality. And that is a very important aspect in COVID-19 or in any disease, because the misinformation can cause people to lose their lives. And we don't want that. We, as an epidemiologist, we want to keep the population safe. We want to learn about the disease in order to give the most accurate information. So in being, through that route, I am going to convert this conference and I am going to convert it into a classroom. So why? Because there is a few terms that we need to know beforehand in order to understand this presentation. So the terms to know right now is epidemic, and that is a word that we have, here so many times since December 31st, 2019, when the first case, was reported. So epidemic is a sudden increase in cases of a disease. And then epidemiology is that the study of a disease and other health outcomes, their causes in the population, and how they can be controlled. We want to control the disease in order to avoid people to get sick. We don't want people to get sick. We want people to be healthy. But the more we know about the disease, the more arms we have to control that disease. An outbreak is a higher than expected number of occurrences of a disease in a specific location and time. Pandemic is an event in which a disease spread across several countries and affect a large number of people. So taking that into consideration, we want to know what is an endemic, because that's what the people are thinking now. Oh no, COVID is going to be endemic and we are endemic now. Let's see what happened. Endemic refers to the constant present or usual prevalence of a disease or infectious agent in a population within a geographic area. For instance, malaria in Africa, dengue hemorrhagic fever in Puerto Rico, TB, tuberculosis. We have tuberculosis in the Philippines, we have in Haiti. So that those diseases, we know that if we go to that country, we need to be aware that that disease is prevalent in that area, and the probability of acquiring the disease, if you don't get protected, is going to be high. But let's see now what is going to be the difference between an endemic, epidemic, and a pandemic disease. So an endemic is a constantly present in a population or region with relatively low spread. That's the key. Low spread. We are going to have the disease, but the spreading is controlled. So we have that control of that disease. An epidemic is the sudden increase in cases spreading through a large population. And when an epidemic goes out of control, then we have a pandemic, which is going to be a sudden increase in the cases across several countries, continents, or the world. Right now, we know that COVID-19 is a pandemic. So knowing that, then we can understand what is happening right now. So I'm giving you, and now I'm going to start giving you a little bit of COVID-19 general information in order to tell you that the disease have not changed. We have new variants, but the transmissibility, the incubation period, and all the information related to the disease that we have been, explaining, still more or less the same. So in the COVID-19 basics, the World Health Organization first became aware of the existence of this new virus on December 31st in 2019, when it was informed of a group of cases of viral pneumonia that had been declared in Wuhan, in the People's Republic of China. COVID-19, we know because COVID-19, I can say, that have touched the lives of so many families, and they have lost so many family members and loved ones because of COVID-19. And they have a lot of patients with what is called long COVID, meaning long haul, meaning that they have the sequela of what? Of having COVID-19. They survive, but now they are dealing with the secondary effects of COVID-19. COVID-19 is a dangerous and highly contagious disease caused by the coronavirus known as SARS-CoV-2. And as of today, we have almost 1 million deaths has been attributed to COVID-19 in the United States. If I go to the CDC, and I pulled this information this morning because I want to have the latest and greatest information to bring it to the public. If you want to go to cdc.gov, you can see that. You can see what are the trends in the numbers of COVID-19, the cases and death in the US by state and territory. In United States, we have right now, for me, it's very important to explain that almost 1 million Americans have lost their life due to COVID-19. The current hospitalization, if you see the graphic, if you see this arrow, it's not going down, it's not trending down, it's going up. And 82.7% of people 5 years or older had at least one vaccine.
Dr. Nieves, sorry to interrupt.
And then the total
we need to fix the presentation because it's the size looks to be too small. I don't know if you can check on your end to put it on full screen.
Okay, let me change then my screen. So let me change it.
Okay.
Give me a brief moment. Give me a brief moment. Okay, I am going to.
That's okay, but what you were saying about, first of all, to learn the definitions, understand more about the terms, and especially the miscommunication that we hear every day in the news, the internet, social media, all that is extremely important to understand the reality and the real numbers. So I believe that the statistics that you're showing is extremely important for everybody that is watching the presentation today. However, if we have a challenge with the presentation, we can always share with everybody all the data that you collected. And I know that what is most important is to hear from you, from your experience, and all the critical information that you can share with us.
Yes. Can you see it better now?
No, we are having a challenge with the size, but that's fine. We can see you perfectly. So, Dr. Nieves, you can go ahead.
Yes. Let me stop screen share. Let me place the presentation here. Okay, and put it here. And I am going to put it like this. Okay, and then give me a brief moment.
And well, in the meantime, Dr. Nieves fixed that little technical issue. I'm very happy also to see that we have registrations from different channels. We have people in YouTube, we have people in Facebook, we have people also in different stream platforms that we have in Latin America and Asia. And I'm glad to see that people is interested. They still need to know, and they still want to know more about COVID-19. And that's why they decided to participate today in this important seminar. I believe Dr. Nieves was able to fix the PowerPoint, so we can go ahead and keep talking about the numbers.
Yes. Then we can see the total hospitalization right now is 19,151 as the last time that they pulled the data. So these updates are done daily by 8 p.m. So, and you see that the trends are going up. The total cases are going up as well. So people think that that this is over when this is not over, and that is the reason why we want to bring fresh information to the public. So in terms of COVID transmission, breathing in air when close to an infected person who is exhaling small droplets and particles that contains the virus. Having these small droplets and particles that contain the virus land on your eyes, your nose, your mouth, especially through splashes like a cough or sneeze. And also touching your eyes or mouth with hands that have the virus on them. Those are ways of COVID transmission. And the symptoms, still the same. Fever or chills, cough, difficulty breathing, fatigue, muscle and body aches, headache, new loss of smell or taste, throat pain, nasal congestion, nausea or vomiting, diarrhea. But there is another reality. We have patients that are completely asymptomatic, a slight headache, maybe a little bit of, sore throat, and in a matter of hours, the symptoms, disappear, and the person still infecting others, but don't know because the symptoms are so subtle that doesn't think that they have COVID-19. That's one of the situations that we encounter with COVID-19, as a difference of other diseases, is that we have a population that is asymptomatic, that that spread the disease, as well as a regular patient that have, the full-blown symptoms. It's always good to let you know when you have to seek emergency medical attention, when you have trouble breathing, when you have persistent pain or pressure in your chest, new confusion, inability to wake or stay awake. If the person looks pale, gray, or blue, that they have your skin looks like those colors, and also if your lips or nail beds also turns pale or blue depending on your skin tone, that means that your oxygen is going lower, and that means that you need to get medical attention. But remember always to talk to your medical provider for any other symptoms that are severe or concerning to you, especially if you are a high-risk population. This is information that people needs to know, because sometimes people say, hey, you know what, I am asthmatic, I always have trouble breathing, or I suffer from this or other disease, and I have sometimes persistent pain in my chest because I have any other muscular condition. But in reality is that that person needs to get medical attention. Okay. So who is at higher risk to get seriously ill from COVID-19? So what we have, the information that we gathered from the deaths, the amount of death that we have occurred, is that the older adults are at higher risk of getting very sick from COVID-19. More than 85% of COVID deaths occur in people over age 65. And the number of deaths among people over age 65 is 97 times higher than the number of deaths among people 18 to 29 years old. But that doesn't mean that age range is not at risk. Why? Because sometimes people have chronic conditions, and that chronic conditions put you on another level, and a higher risk of, if you became sick or you became infected with COVID-19, the probability of you finishing an ICU unit and be dependent of the equipment that we use to keep persons during a critical stage is going to be, it needs to be used. So those chronic conditions are diabetes, cancer, renal disease, chronic lung disease, HIV, cardiovascular disease, and pregnancy. So I'm going to give you an example, and it's an example that touched me. As one of my family members, he received a kidney 4 years ago, and he was the happiest person alive, and he received his kidney on Father's Day. He was so happy, and his life changed immediately. 2 months ago, he developed COVID-19, and he passed away, not because of rejection for his kidney, for his brand new kidney. It was a situation with his pulmonary system and all the medication that he used in order not to reject his kidney. So this is very real, and we need to open our eyes and think about what I can do in order to prevent to get sick with COVID-19. Knowing the data, knowing everything that we have on our hands, I think that there is a lot of things that we can clarify to the public in order to help them take better decisions. So this is a myth versus reality, and let's go to see 7 myths regarding COVID-19. Myth number 1 is vaccinations are not necessary if I already have COVID-19. No. Let's see. People who have had COVID-19 still needs to be vaccinated. The duration and amount of time that antibodies protect after an infection is unclear, but we have calculated an average of 90 days, and 90 days is it's only 3 months. Like other viruses, reinfection with COVID-19 is possible and is happening. I have people that have COVID-19 2, 3 times. And you say, what? So I don't have immunity for life? No, you're not going to have immunity for life. No, if you had COVID-19 in the past and you survived the disease, then 90 days later, if you start with symptoms, then we recommend you to be tested, to follow the infection prevention practices until you got your result. And if your result is positive, you need to continue with the whole recommendation of being a positive patient again. So the best recommendation is to get vaccinated once you no longer have symptoms and the infectious period has passed. When that happens, you are feeling good, you feel strong, go and get your COVID-19 vaccines. And myth number 2 is that vaccination for COVID-19 may cause the COVID test to come back positive. And I remember I was listening to a conversation. I was, doing a conversation with my husband, and something happens that one of our close friend, he said, "No, I am not going to be tested because I have the vaccine, and my vaccine is going to tell me that it's going to be my test is going to be positive because of my COVID-19 vaccine." No. What is the reality? None of the licensed and recommended COVID-19 vaccines cause you to test positive for viral tests. And the viral tests are the ones we use in order to see if you have a current infection, if you have an active infection. If your body, create an immune response, and that's what we want when we do a vaccination, which is the goal of every vaccine, is to boost that immune response and say, hey, if COVID-19 is going to enter my body, it's going to be rejected because I have antibodies. You might test positive for antibody tests, which is completely different story. Antibody tests indicate that you had a previous infection and you have made a previous infection and might have some level of protections against the virus. But in this case, that antibody test also because you have what? You have the vaccine. And this is very, very important to explain that is a myth. If you have your vaccine, if you need to be tested for COVID-19, you are not going to test positive because of, the test that we use for, to see if the person has the disease. You're not going to test positive because those are two different processes that is happening. One is related to receive the vaccine and the development of antibodies, and the other one is related to being exposed and then tested for COVID-19. For the vaccine, I'm not going to, you are going to become a positive case because of the vaccine. That is not correct. So, vaccines against COVID-19 contains a microchip, and that has been the talk of the town for many, many months. That, and people, you see, in YouTube, you see people saying that they put something that is a metal and they put a metal, attached to the skin and they leave it there and they stay there. Those are things that, those are myths. So we need to understand that the reality is that the vaccines against COVID-19 do not contain microchips. That vaccines are created to fight diseases and are not given to follow your movements. Because, for instance, my dog has a microchip, and if something happens to her, I will know where she immediately. So, or they are going to, they are going to call me if they found her, and they are going because my information is in the data system that they have. I am not good with technology, but I am good with epidemiology, I bet. So vaccines work by stimulating your immune system to produce antibodies. And we have a myriad of vaccines, and we have been vaccinated since a child is born. The child is receiving vaccines. As adults, we are receiving vaccines in order to produce antibodies. So when we encounter a disease, we are going to be protected. In this case, I have to be very clear that it's not that you are not going to develop COVID-19, but you may get sick with COVID-19 even though you are vaccinated. But the probability of what? Of finishing in a intensive care unit or finishing, with in a critical condition is lower than one that doesn't have any protection at all. So after getting vaccinated, you develop immunity to that disease without having to get the disease first. So I prefer to have an injection, to have my vaccine, and then develop antibodies. And then if I am exposed, then the probability of a critical illness is going to be lower. So people can get COVID-19 by drinking potable water. The reality, there is no current evidence that people can get COVID-19 from drinking water. The COVID-19 virus has not yet been detected in drinking water. Conventional water treatment methods that filter and disinfect water, like those in most municipal drinking water systems, should remove or kill the virus that caused COVID-19. And epidemiologically speaking, if the COVID-19 was in the water, then the whole population was going to be sick. So, and think about that. We drink water every day, and we are not sick. So we need to see those response, and we need to see also that this kind of information, we don't want to create a chaos or hysteria in the community. We want to bring you the best information and to let you know what we are doing in order to prevent illness. So, food management. There is no evidence to suggest that food handling or consumption is associated with COVID-19. You can keep washing your vegetables. You can keep washing, the food that you are going to consume. If that makes you, we know that vegetables and other, kind of food or needs to be washed in order to save it. That's food safety. That's fine. There's people that they clean the cans, that they clean everything. If you want to do that, you can clean it. That's fine as well. But there's no evidence to suggest that food handling or consumption is associated with COVID-19, same like water, same like food. But again, remember that we have certain infection prevention practices when we, bring our food, especially the food that comes, for instance, like apples and also, cucumbers or any food that you are going to eat. Is always recommended to wash it first and then you can eat it as normal. So a myth number 5, and this is one that have a lot of controversy. The vaccines are not safe for pregnant women or women who are breastfeeding. And I have a good story with this one. The reality is that the American College of Obstetricians and Gynecology states that COVID-19 vaccine should be offered and is offered to women who are breastfeeding, similarly to women who are not breastfeeding, and should not be denied to pregnant women, and the doctors are recommending that. My personal experience is my daughter. She was pregnant, and at 7 months, she got her COVID-19 vaccine. And then 3 weeks later, she got her second shot, and she did it in order to protect her baby. They also has an application that she fill it out. And in case that she has any side effects or any situation that maybe needs to be reported, that they enter that information and goes directly to the CDC. She has a beautiful 11-month-old baby, and she did it because she wants to pass those antibodies to her baby. That she did, and she's doing perfectly fine. I had COVID-19 in the past, and I cannot donate blood. Reality, if you're healthy, the American Red Cross and the FDA encourage you to make an appointment and donate blood. They need that. They need that plasma. They need your services. We still need blood. We still have patients that needs, COVID-19 is not the only disease in the spectrum of the diseases. They have patients that needs blood. They have patients that are dying right now because they don't have enough blood in the bank for those patients. So they have certain requirements. Of course, you need to be fully recovered. You have to be symptoms free for 14 to 27 days. And then down, you need to fill out all the requirements for donations that are specific when a person is going to donate blood. So the myth number 7, and I'm going to explain a little bit this, the pandemic is over. They release no more masks when you travel, no more mask, requirement the students are inside a bus. That was a big no-no in the past, because the space with the children inside the bus, or they don't have 6 feet, is closed. It's a very, very close environment. But now, when you go to the stores, when you have to go to run some errands and go to get groceries and this, I can count with my hand the people that are not wearing masks, because either they are vaccinated or they don't want to get vaccinated, but they think that this is over and I am not going to get to have any more protection. When you see those graphics at the beginning, you see that trends, and that graphics is from today, and the trends are not going lower. The trends are slowly but surely going up. And the reality, what is the reality? The reality is no, the pandemic is not over. COVID-19 is not over yet and won't be over anytime soon. People are still getting ill, and it's too early to call it over. In order to be an endemic at endemic level, we need to know what are the number of cases that we are going to be reporting steady, month by month, in order to say, okay, we are in a pandemic state right now. Everything is fine. It's like the flu. The flu, where right now we know that the flu is endemic. We have flu cases the whole year. But then we have what is called the flu season, starting by late September and then finishing by late March, April. So we have cases, yes, 1, 2, 3, 4 cases. And then we start the peak. And then that peak goes down and then goes back to normal. But difference in COVID-19 is that we don't have that yet. We need to keep protecting our family. We know that, the situation is concerning, but we have the tools in our hands to prevent the spread of the disease within our family, within our community. And let me tell you how to protect yourself and your family, your loved ones, to acquire COVID-19. So, how to protect yourself and your loved ones? Number 1, get vaccinated. Vaccines work. I know a lot of people that they have COVID-19 and they are vaccinated, and they have very mild cases, and they recover very fast and go back, to their normal, lifestyle. Vaccines work. Children also. We don't want, when children go to school, they mingle with other children as well. Now they are not using masks, or it depends. It depends on what kind of authorities they have. Depends what kind of norm they have in the place they go. But if they are if they have the age to be vaccinated, please vaccinate your child, because you are protecting your child, but also you are protecting your family. Because one of the things that we have seen that is happening quite often is that the child is not vaccinated, and then the child gets sick. Mild, maybe. Critical, could happen. Yes, we have cases. And also comes and bring the disease to the elderly, to the grandparents, to the parents, and they get sick. And we don't want that. So if we can be a family that, the kid meets the criteria to be vaccinated, please vaccinate your children and protect them as well. I know that the wear a mask is kind of now, and people don't want to wear masks. People don't want to. But what happens when you are going to board a plane and you are vaccinated and you don't want to wear a mask? But still, we have persons that are not vaccinated. We have persons that even they are vaccinated, they can have the disease, and the disease can be, they are perhaps asymptomatic. And this is my perspective as an epidemiologist. I am going to wear my mask when I am inside a plane. That is not going to change me, because we can have children, and children less than 5 years old, and we need to protect those children as well. That they are our future. And for me, as a healthcare professional, as an epidemiologist, as a professor, I know the science behind a mask, a simple process that can help so much. A mask work. See it. Look, one of the biggest examples that we have in history is the decrease in the numbers of flu when we start wearing masks and following the infection prevention practices. The flu cases went down, and we have that information because beforehand, because we know that in South America by that time it was winter, and they don't have as many cases as they have before. And they say, hey, you know what we are doing different? We are doing something different. Yes, we are wearing a mask. We are following social distance. And we have the tools and the resources in our hands to decrease the number of cases and to decrease the exposure. Keep your distance. Even though you are vaccinated, keep your distance always. Avoid crowds and poorly ventilated indoor spaces. Wash your hands always. Use hand gel if you don't have, a sink near you that you can use soap and water. I always carry my antibacterial wipes. I clean my hands every time I go any place, and it's not that I have that kind of adhesion to washing my hands. I teach people how to wash their hands, but I know without a shadow of a doubt that washing your hands is the best way to prevent diseases. And then, if you are sick, please do a test. Please have a test for COVID-19. One of the areas that we are observing right now is that, we don't have too many cases as before. But the only way that we know if we have cases or we don't have cases is by testing. If people don't get tested, we are going to have that false sense of security that, this is going down. We don't have too many cases, but we don't have too many cases. I understand that people are vaccinated, that people are, still having that confidence that, I need to protect myself, I need to protect my family. But if I have symptoms, doesn't matter. I am going to test for COVID-19. And if my test came back negative, and if I have symptoms, I am going to continue with the precautions, because the tests are sensitive. However, it depends of a lot of variables, like who took the test, how they took the test. There's a lot of things to take into consideration. But the driver here is that if the person has symptoms and the test came back negative, please continue with the precautions. So now I am going to open the forum for questions, and I'm going to do my best. If I don't have an answer to that question, I am going to, provide my email in order to get that answer. I don't want anyone to be without a response, because the information that we provide can save lives, and that's the purpose of all this.
News, or like I said before, social media is not necessarily the real situation, and we don't really know what to believe anymore. So I'm going to ask Ronan to please put on me on the full screen. You can close the presentation, Dr. Nieves.
Okay, perfect.
Yes, thank you so much. Yeah, I have a few questions actually that the audience was asking. The first question is related to the variants, the different type of variants. Do you think that is a combination between, people getting vaccinated, is a combination of people wearing masks that, is preventing to people to get sick? Or is the type of variant that we're living? Because I remember that the Delta which is
Mhm.
was a very strong variant that I also had a very bad family experience with that. It was dangerous and killed a lot of people.
Yes.
And now we're talking about this new variant, which is the Omicron.
Uh-huh.
And when you see the statistics, it's really not that strong. Like you said, the symptoms are mild. So it's a combination of elements, or is the type of various variant that we have in this moment?
The thing is that viruses are here to stay. They mutate. In this case, Omicron was more transmissible. And when you have a disease that is more transmissible, you are going to what? You're going to have more people, that are going to get the disease because this is more spreadable and it's more virulent, meaning that perhaps with other viruses you need more amount of virus in order to be exposed to more amount of virus in order to get to develop the disease. In this one, since it spreads so easily, you are going to catch the disease and then it's going to be mild, however still COVID-19. So we can lose the perspective because, oh, it's mild, it's going to be, still people are dying. And Omicron is the one with the highest amount of cases. However, each person is different. Each person have different concomitant condition, chronic conditions. And maybe a person that at Omicron, okay, you know what, something happens and I feel good. It doesn't hit me so badly. But on the other hand, we have what? We have patients that are on a list for lung transplant. And that's what we need to know, that to understand is that COVID is COVID. Delta was very, the mortality by Delta virus was very high, but the transmissibility of Omicron is very high as well. So here, at the end, what we have is that we have COVID-19.
Yeah, I
The
believe
way,
the question was referring more to the fact that the
uh-huh.
type of variants that are coming, because I assume that more variants are going to come in the future. Like you
Yes,
said, COVID-19 is not going anywhere. We're going to probably learn, and we're all actually learning to live with this virus. But as we have more variants, what the question was referring is that probably these variants are going to be mild and to lower, the case of deaths are not going to go up. And instead of that,
exactly.
probably they're going to transmit more, but the number of deaths are going to be down. What do you think about that, Dr. Nieves?
Well, the number of deaths are going to be lower if we get vaccinated. The number of deaths are going to be lower if we follow the protection, if we follow the infection prevention practices. Okay, and each patient is different. Each person is different. For instance, we have persons that have Delta and they were like, fever, this and that, but nothing extreme like other patients that in 24 hours they were connected to a ventilator. Each person is different. But I can say that virus mutates because they need to survive. Same
Mhm.
way that when we are in a cold weather, we wear a jacket. When we are in a hot weather, we use light clothes. So the same way is that the virus are going to mutate. And same happens with the influenza virus. We have influenza all year long. And each year we have, they prepare the vaccines based on the viruses that were detected the year before. And they try to, give you the immunity for those virus before in order for you not to develop the disease. But with COVID-19, this is a new disease. This is a novel disease. We still are learning the natural history of the disease. Each disease has a history, and we are still learning about COVID-19. So
Mhm.
sometimes there are going to be questions that we don't know right now, but we know that with time we are going to be able to answer.
Another question is regarding the children. You mentioned that you recommend children to get vaccinated. The concerns that some of the parents have is why I don't know what is the vaccination about. It's not proved yet. It's a new vaccine. So what is going to happen with my children about the secondary effects, or that is not, that it didn't go through the process of for the approval when usually happens with a vaccine, right? Like I don't know, the chickenpox or etc.
Yes. Um, my recommendation is, first of all, if you need to travel because you need to travel. So if you have a toddler, if you have a child, and if that child is immunocompromised, if that child is taking medications, if that child is asthmatic, if that child, you need to see each child in their own perspective. You are traveling because you need to travel. This is an emergency. If you travel, can you travel, in you have any other way of get from point A to point B? Because now, the mask is not required. And you are going to put a little one, inside a closed space that we know that we have the air, and the air is recirculating and it's clean air. But what are the probability of that child develop a disease? My recommendations always when a person travel is to always clean all the trays, clean everything, bring your wipes, wear your mask, and those kind of infection prevention practices that you use as an adult. For me, I will keep wearing my mask, but it depends of each parent that what they are going to do, why they need to travel, why they need to to go from point A to point B. So that kind of questions, for me is that always.
Yeah, it's more like a personal decision, right, doctor? But I believe the question is more like the concern they have. If my kid is healthy, should I get the vaccine? Like you mentioned, if they have like an immune system low or some other problems, probably they should get the vaccine. But what about the kids that are healthy? Do you recommend to get the vaccine as well?
Well, if the kid meets the age to be vaccinated, yes, yes. If they have the age recommended by the company, that the pharmaceutical company, yes, please vaccinate your children, because you are going to protect them as well, and you are going to protect yourself and the people in your house. Because remember, the children go to school, they are exposed, they play, and they don't have that boundary. No, you know what? I need to watch my. No, you know what? No, they go in the sandbox, they go here, they go there, and the teachers try to keep the environment clean and so on. But there is a moment that is a breach, and they need, if they have the vaccine, they're going to be, the probability, if they develop the disease and develop other symptoms or critical symptoms, are going to be lower than a person that doesn't have any vaccine at all.
Perfect. Another question is, what are your recommendations when traveling on planes? Also, traveling with a toddler to keep them safe?
Yeah, when traveling on planes, we know, my recommendation always is going to be, remember, I am pro health all the time, is that please wear your mask. Don't feel awkward if people look at you like you have two heads. No, you keep wearing your mask. You keep taking your precautions. Wash your hands. You don't have, use the alcohol gel, use your disinfecting wipes, clean the area that you are going to be sitting, and then enjoy your travel. That's the only thing that we can do. And then follow yourself, follow 1 day, 2 days, 3 days after you travel, check yourself, temperature, see if you have any symptoms, and see if you didn't develop any kind of disease after you travel, especially 5 days after.
I believe that especially because now with this Omicron variant is very similar to the regular cold. People get confused all the time, and you don't really know if you have COVID or not because you may have, these mild symptoms. So basically, what you're saying is, you recommend people that if they have a symptom, even though it looks like a regular cold, to go and
Yes,
test.
yes. And even in United States, you have there is a link that you can ask for tests for home, and they give you 4 tests free. Okay, and then, or you can go to your provider, or you can go to the pharmacy, or you can go to the places that they are doing testing. So if you feel sick, my best recommendation is to get tested. And if the test came back negative, and you are still and you still have symptoms, please do then, we have the antigen test. That is the test that you can do at home, but we have the other test, which is the PCR test, which is a DNA test, but it's more precise, more sensitive. And then is, even though that PCR came back negative and you still have symptoms, please follow the precautions. all
The
of it.
last question, Dr. Nieves, how do you see the near future in terms of COVID-19?
I see the future that we are going to keep, having cases, but it depends on us. Is the mentality that people don't want to get vaccinated, that people wants to continue like nothing happens. But we have a history of almost 1 million deaths for COVID-19, and we have 83 million cases already. But think about it. This is a reality. This is something that we have to deal every day, and we cannot we lower our guard. We need to keep, using the precautions. We need to, we know that we have family gathering, that we are very social, that we want to spend time with the family, that we want to hug, we have to this, we have to do that. But you know what? Think about that. Think about that. We're still in a pandemic phase. We are not endemic now, and we are not going to be endemic, in a near future. We are going to continue to have COVID cases. And since that, we need to keep protecting ourselves.
Dr. Nieves, thank you so much. Like I said before, extremely important information. All the content and all the data that you presented today is very important for everybody to learn, to understand, and to have a better view of what is going on every day. Like you said at the beginning, people think that, we don't have any more COVID, no more cases, but it's not true. The reality is that cases is still out there. Actually, cases are going up again. And the fact that, more people is surviving this virus doesn't mean that we are getting rid of this virus. So please take all the precautions like Dr. Nieves recommended, get the vaccine. And like you said, it's everything about your decision. It's a personal choice. But whatever you want to decide, always verify everything before you make your final decision. Dr.
Beautiful.
Nieves, I think we need to have a third round of this webinar. Hopefully,
Absolutely.
it's going to
Come with me.
be talk about no more COVID-19.
Yes, we need to have one that's going to be lessons learned from COVID-19.
I love it. Okay, I'm going to write
Lesson
down.
that I learned is that we are all in this together, that we love our family, that we have to make certain sacrifice, like wearing a mask and sweating a little bit. When I place my mask, I say I have my little face sauna, and maybe my face is gonna shrink a little bit, but that's good. I'm protecting myself. I'm protecting my family. I'm protecting my granddaughter. I'm
Talking
protecting,
about the mask, there is
everything.
one question, Dr. Nieves, that I,
Uh-huh.
I forgot to ask, and somebody actually did. People is talking all the time about different type of mask. What mask would you recommend to wear?
I always recommend the KN95, which is not as hard as the N95. The N95, leave it to the healthcare professionals. I always use the KN95 cloth masks, as has demonstrated that they are not as, as the efficiency is very, very less, maybe a 10%. But KN95, if you're going to travel, please try to get one that you can buy it for bulk and use it. And, but that's the one I always recommend. That's the one I always use. You know.
Perfect. Thank you so much, Dr. Nieves. Final words before we finish the webinar.
Please keep your families safe. Please follow the CDC recommendations. Don't follow, what person A, B, or C, or D said, or do what other person, or take this medication, or no. Let's follow science. Let's follow our doctor recommendation. Let's follow, the organizations that are the ones that are dealing with this disease, and not only COVID, but other disease around the world for decades. We have so much resources in our hands. We need to use it wisely in order to protect the population, the public, our family, and in order to be able to celebrate all the milestones in our family and, around the world. Thank you, Maria. It's for me an honor to be part of this amazing group, and I thank you, Ana Jimenez University, Cynthia, Diana, Mike, academic director, that she was the one that recommends me. I feel more than glad that convert this forum into a classroom for you guys to understand the importance of be prepared and be educated.
Thank you so much, Dr. Neves. For sure, I'm going to see you in the third round, which is going to be about what you say? What was the name?
Lessons learned from COVID-19.
I love it. Thank you so much and see you next time. And for everybody that is here with us, remember that tomorrow we have another amazing webinar. If you are planning to get a loan, if you want to get a loan but you don't know how, if you qualify or not, join tomorrow's webinar. Our presenter is going to explain you everything, all the steps you need to have to apply for a loan. They actually help you with all the process, and they help you to access the loan. So don't miss the webinar tomorrow. If you want to register, you can visit our website, global3chamber.com. You can also check in our Facebook page the upcoming event, which is tomorrow, if I'm not mistaken, at 2 p.m. Please join us. Thank you so much, 𝐭𝐻𝐻𝐿 University, to sponsor this amazing webinar. See you next time, everybody. Take care.